Hello volunteers, thank you for volunteering at the vision screening booth. Your vision is one of the most important senses, and so we're going to screen at this health fair for vision. We're going to do 5 tests for a lot of patients, and I'm going to teach you how to do all of them. All right, first off, 4 of the tests you're going to test each eye separately, and then 1 test you're going to test both eyes together. The first test is going to be the vision or visual acuity. So you can test it either at distance with an eye chart, which you're going to have, and that's the most common way, or you can test it at near with a near card, having patients read. You may have heard the terms 20/20. That means what a normal person can see at 20 feet away. So the way we record vision is based on what a normal person can see at 20 feet. So on this eye chart, we have 5 lines. You're going to have an eye chart with more lines. And the top line is the number we see here. So this is, if the patient can see this, it's 20/50, and then 20/40, 30, 25, and 20/20 is the bottom line. On the near card, you can see the numbers here on the side. It's really important to check each eye separately. So you're going to have something called an occluder, which is like this. You're going to have the patient hold it like this so that one eye is covered, and then flip it around to check the other eye. For our vision screening booth, we're going to be checking vision at 10 feet, and there are different eye charts you can buy that are standardized for 10 feet instead of 20 feet. Same as in this exam room, this is standardized for 10 feet from here to where the patient sits. There is this little drop down on the occluder that is called the pinhole. So if patients have a vision problem that can be fixed with glasses, and you put the pinhole down and they can see better further down the eye chart, that means it can be fixed with glasses. If the pinhole doesn't help their vision to see better, then it most likely cannot be fixed with glasses. Basics about the eye to do the next test. This is the Amsler grid, and this is a screening test for central vision loss. The way you do this is, again, each eye separately. You have the patient look at the center dot. If they wear reading glasses, you have to have them wear the reading glasses during this test, and make sure all the lines are straight and nothing is missing. If something is missing or not straight, wiggly, they could have a problem in their macula. And the macula is the center part of the retina. So the eyeball is like a camera. This is a cross section. The front part is the cornea. Then the shutter is like the iris. The opening is the pupil. The lens focuses the light onto the retina, which is the film of the camera that helps you see. All the retinal fibers collect into the nerve to the brain. The center part of the retina is called the macula, and that's what the Amsler grid screening test is going to check for. Macular problems, including macular degeneration. The Amsler grid helps check for macular problems. The most important one to check for is macular degeneration, which is the #1 cause of central vision loss in Americans over 65. The Amsler grid can also tell us if anything else is wrong with the macula. The test can also tell us if there's something else wrong with the macula, such as swelling or membranes or scar tissue. The next screening test we're going to be doing is the color vision test. This is called the Ishihara color plates for color deficiency, but this doesn't just check for color blindness. This can check for optic nerve problems. That's the cable to the brain. So if someone has an optic nerve problem, they could have been normal before and they could miss things on this test. So there's 12 or 14 plates, depending on which book you have. The first plate is the test plate. Everyone should be able to see this plate. If they can't see the plate, either their vision is really, really, really bad or they're lying. The next plates start the test plates. And this will tell us whether if they miss any of these tests, depending on what the colors are, orange and green green again. They're all orange and green, actually. I don't know if I realized that. Depending on what they miss, there's a little guide here that you can read, and it will tell you what kind of color deficiency they have, whether they're colorblind for red, blue, or green. But if they could see it before and now they're missing it, that could tell us that they have an optic nerve problem, such as optic neuritis for multiple sclerosis or a stroke in the eye. Again, just like the other tests, it's important to check this one with each eye separately. And if they need reading glasses to see better, that's fine. Most people don't need reading glasses to see this test. An important screening test for patients under 18, but especially for kids under 8 or 10, would be the stereo test, or stereopsis. Stereopsis is your 3D vision, and it is determined, it helps you with your depth perception, and it is really determined by the time you're 8 to 12 years old. But there's important landmarks around 18 months, 4 years, 8 years, and 12 years of when this is fixed. So if there's a deficiency in this, and we fix the child's vision with glasses or whatever they need surgery, then this can improve. And it's really important to have good depth perception. The way you do this screening test, again, we're not going to be doing this in adults unless you really want to. It would just be in children if they're doing the screening. You have them wear these stereo glasses, and again, for safety, in between patients, we're going to be cleaning the earpieces with alcohol swabs. You don't want to clean the lens part with alcohol because that will damage it. You have them put this on, and then they look at the images. I don't know if it'll work if I do it through the camera because it is not stereo, but they should see a 3D fly. Kids, you have them basically, the way you ask the questions is pick up the wings of the fly, so they should try to pick it up like it's 3D. Then you move on, so if they get the fly, great. Move on to animals. They should be able to pick out which animal in each row is 3D with the glasses on again. And then we do the circles. And so they go through each set of 4, and you should be able to pick out which circle is popping out at them in 3D. And you record it on the screening form as, 1 out of 9 circles, or 9 out of 9 circles if they got all of them, or 1 out of 3 animals, or 2 out of 3 animals, or 3 out of 3 animals, or if they only got the fly, then plus fly. If you can't see it, you should see your eye doctor, but if you need the answers, they are in this little handy dandy reference guide. Another important screening test to do is confrontational visual fields. Sounds funny because we're not confronting the patient, but we're going to be checking what they can see in the periphery of their vision. So important for this, this is screening for glaucoma or stroke, okay? What is glaucoma? Glaucoma is damage to the optic nerve, that's that cable to the brain, that makes you lose your peripheral vision first, to central vision, to total blindness. It's really important to catch glaucoma out here versus when the patient's already lost the majority of their vision, because we can't reverse it. It is the #1 cause of irreversible blindness in the world. So glaucoma is technically an optic neuropathy, which just means that the optic nerve is damaged. The way you're going to test this is you're going to be about 2 hand lengths away from the patient, and I'm going to demonstrate with one of my staff. Okay, so when you're doing confrontational visual fields, it's important to be eye level with your patient. You're going to be most likely standing at a screening test, and then we're going to be about 2 arm lengths apart. Can you put your arms up? There you go. You don't have to do that with the patient, but that's about how far you're going to be. You're going to have the patient cover one eye. So again, this is a test we have to do each eye separately. So they're going to cover their left eye. You're going to close the same eye facing them. And then have them look at your nose, looking at my nose. You're going to test the temporal visual field and the nasal visual field of that eye. So we'll do 3 locations. First, straight ahead. Can you see my fingers?
2.
And then superior.
1.
And inferior.
2.
And then we're going to do it again.
1. 2. 1.
you should be able to see your fingers. So if you can do it way out here and you can't see your fingers, guess what? The patient can't see it either. So you have to do it somewhere where you can still see your fingers. And then you switch sides. Uncover, cover the other eye, you close the eye that they're covering, and do it again.
1, 2, 1.
And then again, superior,
1,
in the middle,
2,
inferior.
5.
The way you record the test results, if they miss anything, there is a circle on the screening form. You're going to fill in the shaded area of which part of that visual field they missed. We're not treating at a vision screening fair, but if they miss something, it's really important to emphasize to the patient that they go see their eye doctor to figure out why they're missing parts of their visual field. The other thing we're going to be doing at the vision screening fair is giving away samples of artificial tears. Legally, we can only give away things that patients can access over the counter, so buy in any drugstore or grocery store. But a lot of patients have dry eye disease. And these are artificial tears. They're just lubricants that patients can use, just like lotion for your hands, lubricants for the eye. If they're in a big box, they usually have preservatives. If they're in a wide box and inside there's little vials, they're preservative-free tears. Whenever you're giving out any samples, it's important to check the expiration and make the patients aware if the expiration is nearby. Make sure patients know to not use eye drops more than 4 times a day because that can damage their eyes unless that was directed to them by an eye doctor. We're not going to be giving more than 2 boxes per person. There will be coupons to give away as well. The other thing we may have available to give away is over-the-counter vitamins. If the patient has a family history of macular degeneration or they missed something in the macula on the Amsler grid test, make sure they go see their eye doctor, but we will have some samples of what is called AREDS 2 vitamins. This stands for Age-Related Eye Disease Study 2, the second version of it that was done by the National Institutes of Health in 2012, and it has these over-the-counter products, vitamin C, E, zinc, copper, lutein, and zeaxanthin, that can help the retina regenerate every night, as it does, and help decrease the progression of macular degeneration. We will be allowed to give these at the vision screening booth, depending on our supply, because they're an over-the-counter product. We cannot give anything that is prescription. Make sure if you're giving any patients samples, you write it down on their screening form, what they received, and you check the expiration. Thank you for volunteering at the vision screening booth. If you have any questions, feel free to ask me, and I hope you learned something through this experience, and I know you've helped a lot of patients.